The challenge is even, one, we're seeing a lot of advanced cases. So the big challenge is we're not, even though we know who should undergo surveillance, we're not quite where we should be as far as surveillance. So education is very important in that, telling other providers, if you have a patient with cirrhosis, if you have patients with hepatitis B that meet certain criteria, you have to surveillance for liver cancer. So that's one challenge, identifying patients earlier so we can offer them curative options. The second challenge is in what the options that we currently have. Although there are great, tremendous improvements in therapies, we're not currently curing anyone with advanced liver cancer. We are offering them longer survival, which is very important, but and we're not there. And so part of it is that, and what we've talked about in the last 2 days, is liver cancer is such a heterogeneous group of cancers, but not just between people and the reasons that they have underlying liver disease, but between liver cancers themselves in the same person, and even between regions of the liver tumor, one tumor itself. So we haven't really identified these molecular drivers that we can target and kind of personalize medicine for liver cancer. So there's a lot of great work going into it, but we just haven't translated into clinical practice yet. So I think that's a big challenge, But obviously, if we could identify patients earlier, if we could surveillance them earlier and catch them earlier, of course there are more treatment options.